looking at the concept of postoperative endocarditis. Now, for postoperative endocarditis, it's quite simple. Once you look at the concept, you just know that this type of what endocarditis or infections of the heart muscles is as a result of what complications from a surgery that was previously done on the patient. So if you take history, you might find out that probably they did a surgery on the patient, a cardiac surgery on the patient recently. Okay, so post-operative endocarditis is what? Infections of the endothelium or the heart valves as a result of what? Some surgery process that were done previously. Okay, so we said that the post-operative endocarditis is a rare but serious infection of the heart valves or endocardium, and this is usually coming in place after a cardiac surgery. Okay, incidence is about what? 0.5 to 2.5% after a valve replacement surgery. Like your chances of having an endocarditis after a valve replacement surgery is about what? 0.5 to 2.5%. Okay, then 0.2 to 1.5% after a CABG, that's a coronary artery bypass surgery. All right, so after a coronary artery bypass surgery, there are some chances of you developing this. So risk factors now, well, risk factors, if these surgeries like valve replacement, coronary artery bypass, like we've spoken, if there's a cardiac transplant, if there's implantable device placement, right? If you have diabetes, you have obesity, if you smoke, if you are immunocompromised, that means your immune system is already weak. So it's now just like predispose you, make it much more easier for you to now what? Have the infection, right? So types is if you're having an early post-operative endocarditis, it's just usually just less than 60 days after the operation. Then late post-operative endocarditis is more than 60 days after the operation. Okay. Causes could be bacterial infections like what? Staphylococcus epidermidis, could be Staphylococcus aureus. Some fungal infections like from Candida. Then viral infection is rare. Okay. Symptoms is the same thing as what you see in endocarditis. Just that we're saying this type of endocarditis is caused by what? Some operation complications. Not that we're saying it's different, okay? So fever, chills, fatigue, weakness, shortness of breath, chest pain, cough, pale or cool skin, all will be there, right? Diagnosis is when you use a Duke's criteria, okay? Where you are seeing you are using the minor criteria and the major criteria, okay, to make diagnosis. I've already made videos on that. If you want to watch, let me know. Then blood cultures, you are doing this to now identify the organism, okay? Then echocardiogram, electrocardiogram, imaging studies, all of this could be handy. Treatment, use antibiotics, surgery, and supportive care. All right, the patient is having problems in breathing, you give oxygen therapy. All right, then antibiotic regimens is you combine what? Staphylococcus, for Staphylococcus epidermis, you combine drugs like what? Vancomycin and rifampin, right? And for Staphylococcus aureus, you combine drugs like what? Vancomycin and gentamicin. For candida infections, you combine drugs like what? Fluconazole and amphotericin, okay? Amphotericin B, okay? Complications, same complications as what every other heart problem, okay? Myocardial aneurysm, embolism, sepsis, valve perforation, cardiac arrest, stroke, heart failure, right? So that's it for this post-operative what endocarditis. See you guys pretty soon.